informing us on some of the scientific evidence in hemoglobin disorders in general, but also specifically happening in his country. Thank you so much, Hadibur, and I hope that every other member of our CAB stays with us very connected and keeps informing us. Let me also thank members of the board of directors present and past, starting with my friend George, who's on the line, Anton Scafi in Cyprus, but representing the Palestinian, and also member of the TPC, our Thalassemia Patient Connect group. Ahmed Tima from Egypt, Hamza Alihaya from Iraq, Michael Haddad from Lebanon, Riyadh, hello Riyadh, from Canada. Are you with us? Not yet.
Θέλω να σου πω να σε πιάω σε καμιά ώρα γιατί είμαι σε webinar.
Okay. We are listening to your private conversation, George. So, is everyone? Can everyone hear me? Can we massively say yes or no?
Yes.
Good. Okay. So, just as an introduction, I'm just saying that TIF has focused considerable attention, and it is still focusing attention on providing reliable and updated information to our patients and to some extent to our healthcare professional communities all over the world on all aspects of this COVID-19 pandemic. We wish everyone to stay healthy, to stay safe, and we wish all our patients to stay away and to stay uninfected. However, the pandemic, we feel, has affected very important aspects of the care of our patients and has made them even more vulnerable and more at risk to the potential consequences of the infection. May I welcome a friend, long-term medical advisor of TIF, Ali Tafer, you're on the line. Yes, can you unmute?
Yes.
Michelle, are you on the line?
Yes.
Michelle Abisad.
Michelle, yes, Michelle.
Michelle Haddad.
Yeah, but Michelle is our thalassemia.
Yeah, Michelle Abu Said. Abu Saad.
Yeah, Michelle.
No,
where is that? No,
we have two Michelles.
Yeah, but Michelle, there are many.
Michelle Abu Said.
Ah, okay. Michelle, are you with us? Michelle Abisad? Ali Taher? Lebanon is not responding. I hope they're
Michelle
hearing.
Haddad, patient.
Okay. But so as an introduction, I said that TIF is very concerned as to what is happening in the different parts of the world. And very importantly, to see whether in your countries, according to your experience, there is an important regression of the standard care that you're taking, so that we can support you in as many ways as possible in this area. Because we believe at TIF that in addition to what the pandemic can bring and what the infection can bring to patients and to people without hemoglobin disorders, but more importantly to people with hemoglobin disorders, there is a certain significant concern on behalf of TIF that your standard care is being interrupted. your regular blood transfusion, your purchase of the life-saving iron chelation drugs, your monitoring, your multidisciplinary care. These have been disrupted because of the possible blood shortages. We have received information from the other two webinars we've had that there are considerable blood shortages. Therefore, pre-transfusion hemoglobin is dropping for many patients. Patients cannot access their treating centers because of difficulties in traveling and in reaching the specialized centers. We have been reported, patients have been reporting that they have been receiving whole blood instead of red blood cells. Patients have been reported reaching hemoglobins 7 or even 5. Difficulties in accessing their treating centers and therefore getting blood in an unspecialized center with all related adverse reactions. Postponement, as I said, of a lot of monitoring vital tests and multidisciplinary care services. Other reports include reverting to pool blood donation practices or even to paid donation practices. That is diversion from remunerated voluntary blood donation. People are reporting decreased activities of their NGOs in some of the countries which play a very important role in providing drugs to their patients. Therefore, we need to hear your stories so that TIF can complete a paper that is sending to the governments that in addition to providing safe environment for hemoglobin patients not to be infected, they must make sure that their standard care is not interrupted, because interrupted standard care is more serious and can lead to very important consequences than the infection with the virus itself. Therefore, this is where I stop, because you know what TIF has done for the material. You know we've been in contact with you. You know now our concern is first to prevent infection of the patients with this virus, but at the same time to stop interruption of your standard care. And this is where together we must fight together with the healthcare professionals and our national healthcare systems not to have interruption of standard care. Michael Angastignotis is with me. I would like him to say a word to you, and then we'll go directly to you.
Hello, everybody. Sorry for not being directly in the picture. I am now. Okay. As Andrula has said, different environments have different consequences where the thalassemia care is concerned. In some environments, of course, we've got a reduction in blood transfusion. In others, we have other consequences which may disrupt daily care and make the patient even more vulnerable. And therefore, we would like to have a picture. If TIF is going to influence governments, if TIF is going to ask health services to give extra attention, we need to know what is going on. So first, I would really like to invite the doctors to give us a word. For example, is Professor Ali Tahir online?
Okay, until he's online, let us have Beshlawi. Amal Beshlawi? Professor Beshlawi?
Professor Beshlawi, can you tell us a little bit about the situation in Egypt?
Okay.
Just a second, we get the...
Good afternoon, everybody. I'm very happy to be with you today. Actually, the impact of COVID-19 on our thalassemia and sickle cell patients. Fortunately, we have no one case affected by the infection from either thalassemia or sickle cell disease.
Very good.
And most of the people are going on the information coming from the government and coming from the WHO with all disinfection, doing everything to be away from being infected from anybody. And the family as well is very keen to be away in order not to transfer the infection to their kids or their patients. Stay home. This is a very important sentence which you always are hearing in the television and everywhere. Everybody saying, especially patients of thalassemia or sickle cell disease, they are very keen to keep in home. And when they go out, they only go out when they are in need for blood transfusion. In the hospital, when they are going, they are putting mask and they're taking disinfectant in their hands, are doing all the precautions which can prevent the infection to be transferred to them. And in the hospital, we did spacing between patients, and we are doing this in order not to transfer any infection from one to another. And before entering into the session, the temperature is seen and everything will be sure that the patient is not having any symptoms. And as well, patient receive their treatment for 2 to 3 months in order not to be wants to go to the hospital in order to take a medication. Then they will be very sick. And therefore, for the impact of feed and blood transfusion, actually, this is very, very important and very standing among our patients. It is variable in different centers between patient receiving the needed volume, and this is not so much, on the contrary, less, and others with no enough quantity and frequency. If the patient is need for 2 units, we'll take only 1 unit. The level of blood pre-transfusion level is low. Level maybe 6, 5, something like that.
Oh, 5 and 6.
Yes, and for patient donation of blood, this significant drop in the pre-transfusion hemoglobin of the patient, for the patient with a negative effect on their health status, because there is a drop in the pre-transfusion. If he's accustomed to take on 8, 9, or 7 even, he has not the availability to have this transfusion at that hemoglobin level. And we come to blood donation, which is usually in this area is very low because of COVID-19. All the people are very afraid to go out and donate blood. They are very afraid to go hospitals or they're not to catch COVID-19. So blood donation is very low. And because of the holy Ramadan as well, in our country and in all, I think all Islamic countries, donation will be much low and low. But for this reason, many of our patients, and we feel that we have to do something for our patients, we did a poster, as you see on our website, the Egyptian Thalassemia Association website, in order to promote people to donate blood. And you put all the precautions which should be done in order to take a donation from any of the patients. As well as we did other, like the university and the governmental blood banks, they go to the to promote people to donate blood. And this is what we are doing. Any question?
It's okay. What I would really like to know is also about iron chelation and basic drugs. Has there been any disturbance in the flow of these drugs? Are supplies plentiful? And what about things like masks and protective measures? Are they available?
Yes, masks and the protective measures are available. And as I said before, that the patient is receiving all his medication, including iron chelation with him, which can satisfy him for 2 or 3 months. This is what the government gives this instruction for all the hospitals, insurance, university hospitals, and other hospitals.
So the iron chelation drugs are purchased from the
Yes.
hospitals. Yeah. Okay. For 3 months.
Yeah.
So as I understand, the major problem is shortage of blood supplies,
Yeah.
which is a major issue in most countries, if not all. Can I ask the patient from Egypt? Is Manal Zadar on the line?
She's a mother.
Oh, Manal Zadar?
Yeah.
Manal?
Manal? Michelle, are you on the line? Michelle Abi?
Michelle Abisal,
Yes,
she's trying.
She's trying. How about Ahmed Tiama from
No.
Egypt?
He's not in. We have
Oh.
Afshan.
From Egypt?
Yeah, from Iran.
But it's
Patient.
different. Okay.
No, yeah.
Okay.
Go to the
Well,
next doctor.
thank you so much, Professor Beshlai. Do you think that in the rural areas of Egypt, outside your university and your Cairo environment, the blood shortage and transfusion situation is even worse? I anticipate.
Yes, you are very right. Yes. The shortage of blood is more in the areas outside Cairo and outside Alexandria, the main cities. It is remarkable shortage in blood. Yes.
Remarkable shortage.
Tell me one last question, Dr. Beshlawi. How are the blood banks responding to this shortage? In some countries, they ask the patients to bring their own blood donors. Is this the same in Egypt?
Yes. Some of the patients who have got blood group which is rare, they ask them to bring one of their family. And sometimes when there is no blood, they ask the patient to bring one of their family in order, or anyone who is similar in the blood group, to donate blood. This is true.
Yeah. Okay. All right. Thank you so much. I think the next country is Lebanon, but we don't have our Lebanese friends on the line. Is anybody from Lebanon on the line?
Michelle Haddad.
Michelle Haddad? Are you on the line? Hello. Good afternoon.
Oh.
Hi.
Hi. Tell us your story. Tell us how are you doing in Lebanon?
Well, the prevention here is very soft, cool in Lebanon. The Prime Minister is giving us guidelines will be effectively working in our country. We are the number of patients with COVID-19 is decreasing through days. According to thalassemia patients, actually, I don't know if any of my friends, but my close friends, we are safe and taking care of each other, staying at home, of course. We have a little problem with through to bring blood donation, because the donors are very afraid from going to hospitals and donate blood. We have to assure them that it's cool and it's safe to go to give blood, because there's somebody needed help. And the chronic care center always have a effective guidelines to ensure safety between patients and doctors and visitors of the chronic care center. We are having all our treatments and our medical medicines from the chronic care center. Nothing is missing till now, thank God. I think they have already a effective plan to a continuous a continuous plan to give us our treatments like a normal days to stay safe and prevent this COVID-19 situation.
Do you know anything about your peers outside the chronic care center, outside Beirut, for example? Can you make sure, if you don't know now, can you make sure that you connect with other people to see how they are doing outside Beirut?
Yes, actually, I will be visiting the chronic care center in 2 days, and of course, I will ask for and have some more details of patients all around Lebanon. But in the chronic care center, I ensure that all patients are taking their medicine regularly, and in the same time, we still have patients with a low hemoglobin levels, as Professor Amal said, but we still have around 8 at 9 and still have 2 units per person till now.
Okay.
So it's not so acute.
It's not so acute in the chronic care center.
I to add to the question that Andrullah gave you, Michelle, a patient from Saida or a patient from Tripoli, are they allowed to travel to Beirut to come to the chronic care center, or are they requested to go to a
nearby hospital?
The chronic care center is now opening these days, these doors 3 days per week. If patients cannot be able to reach the chronic care center in these 3 days, they have, actually it's sad, but they have to reach other hospitals to have blood transfusion.
Yes. Okay, so Michelle is not on the line, neither Ali Takir.
Just to say that Michelle Abisadi is on the line if she wants to comment.
Yes, sure.
Hello, Michelle.
Can you see me?
Very welcome. We can hear you. And we have made some very good introductions for you at the beginning, but
I'm sorry, I was not connected.
Welcome. Good afternoon.
Good afternoon.
We're wishing you all the best. Stay safe and everything. And let us know a few things about the chronic care center and the patients, both those that can access chronic care center, but also those that are outside Beirut. Our friend Michelle has told us you know, how quality policies you've put in the chronic care center and everybody's safe. Yes. Can you tell us in more detail, Michelle, please?
Yes, sure. Thank you. Sure. Of course, we are like everybody. At the beginning, it was really scary, or we were a little bit skeptical about the situation. But since the beginning, we had our first case in Lebanon on the 20th of February. On the 1st of March, we started a triage unit at the center with all the protection, masks, sanitizers, and we started screening patients at the entrance of the center. Then when we had more cases and we were afraid of a community spread, not only from people coming from abroad. So we had to change all the procedures at the center. So what we have done, we have shortened the number of working hours. And as Michelle said, we have only 3 days. We opened 3 days, but none of our activities were affected. How was this done? We have restricted the entry of people inside the center to make sure that our transfused people with thalassemia are safe. So only the transfused patients, they come inside, and only the people who are under clinical trials, they come inside because they need to be examined. So we have transfusion. Instead of having 15 every day, we decreased to 10 with distancing, of course. And we have a phone call consultation one day before, and the patients, they come and they take their medications from a door, from an outside door. They don't come in. This way we have restricted the number of people coming in, so we keep the center very safe for the transfused patients. We have found that despite that there is a problem in blood donation, but we had an increase in number of patients, of donors coming to the center because they feel that the center is a safer place to give blood versus the hospital setup, because it's a clean place where they can come and give blood donations. Now, since the numbers of cases is stable, we are thinking of loosening up our, let's say, policy, and we will, I think, starting 3 of May, opening 5 days per week as we used to be before, in order to have everybody well served. Still, I can tell you that we are having, the patients are coming from all over Lebanon, from Saida, from Tripoli, from everywhere. We had a little bit some delays in the transfusion because of blood donations or because we are only opening 3 days, but it's not affecting. I just asked all the services to yesterday. It is not affecting actually tremendously the people with thalassemia, our youngsters.
That's very, very good, Michelle. Thank you so much. And now, thank you so much. Wish you all the best. Do you find our material useful? I forgot to ask my friend Beshlawi. You know that TIF is publishing a lot of material on the website, on the social media. Do you read at all? Do you find it useful? Do you want anything else? Do you want anything additional? Beshlawi?
Yes, it is very useful, but there is a comment from Manal. There is only, the first one is translated in Arabic, and the rest is not translated. And this is an issue which has been noticed. It is very, very beneficial, yes. And all the mothers like very much to read.
Yeah.
For their kids.
Okay, we've done a very extensive description of the blood-related issues, blood safety, blood adequacy. Perhaps that needs to be translated. So we'll send it to you, my friend Amal. It's a few pages only. Can you do that?
Okay.
Good. Either you or Michelle. Okay, we'll send it to both and share it in translation. Can you do that?
Okay. Okay.
It's only four pages for the blood, and it is so much important information in this blood safety leaflet, and that it's very important to be translated so that patients can feel that they know also the potential transmissibility or not of this virus. Although what is important for us is what you've just told us, that your standard care is uninterrupted at the moment, with the exception of various degrees of blood shortage according to the different parts. Can we go to Iran now?
No,
Iraq.
To Iran.
Iraq.
Oh, Iraq. Yeah, but
No, Dr. Mohammed Darwish.
Is he on the line?
Yes,
No.
Thank you.
Dr. Mohammed Darwish?
Dr. Muhammad?
Okay, but
can you hear me, please?
Yeah.
Yeah, good.
1 second, please.
Can you show the slides, please?
Yes, just.
Good afternoon, everyone, and thank you so much for this opportunity. I would like to thank all the TIF colleagues for organizing this prestigious program. I'm Dr. Mohammed Darwish Saeed. I'm a clinical hematologist from Erbil Thalassemia Center in the north of Iraq, in Kurdistan region of Iraq. Yes, thank you. Regarding our experience in dealing with the COVID-19 infection, fortunately, and thanks God, there were no reported cases in our area, in Kurdistan region. And fortunately, the standard care does not interrupt it. So the precautions that have been taken according to the national guidelines in north of Iraq are the following. They travel to hospital only in case of emergency or for hospital visits advised by the team, the medical team, according to the needs for blood transfusion. And only one healthy relative should accompany the child to the hospital and they should carry hand sanitizers and wear face masks and gloves during the hospital visit. And in the waiting areas, a special area in the triage unit, and in wards maintain distance from other patients and relatives as much as possible. And those lives in the quarantine area zones, the lockdown zones, were positive. I mean, the other cases, rather than thalassemia and the sickle cell patients. So those families that live there must be transported by ambulance to thalassemia center. This is what happened in our area. And the families and the patients were given a license paper. This license paper from our thalassemia center administration to bypass the security units, lockdowns to the hospital. And any visit to the thalassemia care center should be appointment booked in advance via helpline telephone device 2 to 3 days before, and emergency telephone numbers 24 hours. Excuse me.
Working for how many patients you're taking care in your center?
So in our center, in Erbil Thalassemia Center, we have about 1,000 thalassemia and sickle cell patients, more thalassemia major patients. Yes, those you know, we have Syrian refugees and internally displaced peoples from other cities, other provinces in Iraq. So the Syrian civil war since 2011, you know, the invasion of the ISIS in 2014 and the counter-military operations have forced millions of people to flee their homes and seek safety in Kurdistan region of Iraq. So currently the Kurdistan region hosts approximately 245,000 Syrian refugees and 1.2 million Iraqi internally displaced people. And, you know, this makes burden and strain on our health system to provide medications, especially for thalassemia and sickle cell patients, and to provide blood transfusion. But hopefully, you know, we in the Ministry of Health and with colleagues in the thalassemia units, we made a risk assessment and we made the plan for risk mitigation, how to deal with the situation. So thanks God, there are no cases of thalassemia and sickle cell patients infected with COVID-19 in our area.
Okay.
Excellent.
That's very good,
What about blood shortages, Dr. Darwish?
Yeah. There's no blood shortage, fortunately, because the central blood bank, which established by the UK members, UK bodies, the blood bank center have taken the essential measures during the pandemic in coordination with blood donor organizations and thalassemia associations, thankfully, to overcome the shortage of the blood. And fortunately, it has been able to meet immediate patient needs. So it's worth to thank the Kurdistan Thalassemia Societies because they have a very essential and good role in this case during the period of pandemic. So they conduct campaigns to encourage blood donation. They collect about 700 blood units in the last couple of weeks. They raise the funds to support the poor families. They organize medical teleconferences and support groups of patients and healthcare professionals. So, as I told you, the major challenge in our area was the Syrian refugees and the influx numbers of the Iraqi internally displaced people. That makes a burden and strain on our health system, and the shortage in providing enough medications for those patients, because our patient in Erbil, thankfully we have no any shortage of medications, of bloods, of PPEs, the personal protective equipments, so all are available. But actually for the Syrian refugees and the displaced people, they have obstacles in the security units, and they don't reach our center in the same time, the same day that they need the blood transfusion.
So there would be delays for them.
Yeah.
Yes, yes.
Actually, it's very good, the measures that have been taken. Are you aware of what is happening outside your area, outside your clinic? Is it so good as the measures that you have just mentioned to us that are excellent, you know, giving the pass for patients to pass through the log police or...
Yes.
Yeah. Are these measures across the country?
Of course, you know, the government, there are recommendations and instructions, the general instructions to between the provinces to ban the flights, to prevent you know, transportation from city to another, and inside the city, also in Erbil city, they did a lot of disinfecting procedures. So the security units are perfect. So, you know, all the national guidelines have been taken into account.
Okay, very good. I think that we are all very pleased to hear that you have no infected patients. Okay, thank you so much. Is there anything else that somebody from Iraq can...
We have another doctor from Baghdad. We'd like to ask her.
If it's the same situation...
She's a patient and doctor.
She's a patient and doctor.
From Baghdad, Isra.
Okay, because we've got to run a little bit faster. Who is the other one from Iran?
Dr. Isra. Dr. Isra, are you in?
Are you on the line, Dr. Isra?
Yes, I am.
Tell us your story, which I hope is the same.
Hello, everybody.
Hello, hello.
She got married.
How are you?
We are very well, and how are you?
I am Dr. Isra from Baghdad. I will speak in Baghdad centers. There is 0 cases of COVID-19 in Baghdad, about thalassemia and sickle cell disease.
Yes.
Are you here? In general, they work very good. People follow government guideline for COVID reduction. We are in quarantine from 17 March until last Tuesday. There is about 25 cases of COVID, mean number of cases per day in Iraq, in all Iraq. About thalassemia centers in Baghdad, they do the best. There is to provide safety to thalassemia patients. there is someone of the staff standing in the outdoor of the center, and they measure the temperature for each one enter the center. Also sterilizing alcohol everywhere in the center's part. All the staff and sub-staff and the patient wearing gloves and the mask. About inadequate supplies, there is stinginess in blood, also in mask.
Blood shortage.
Hasamendin,
We lost her.
Isra.
Hello?
Yes, there is blood shortage in the cause is from central blood bank, from the national blood bank. There is decreased donation, blood donation.
How, to what extent is this shortage? Does it affect significantly your transfusions?
Yes, it's significantly. The HP is now reading 8, while I am
which is
reading,
usually you are usually 9.5, 10.
10 and above.
10 and above. So that means if it affects you, it means there are severe shortages. Okay. Anything else you need to report before we go to the next country? But I want to record about myself, my situation in the first period of COVID in Iraq. I passed in a stressful condition that caused me hemolytic crisis and Coombs positive. Doctor see the results about Coombs and they refused to give me a steroid. Advice only for get rid the stress condition. Only that. But your hemolytic condition was not related to your transfusion or to COVID virus, yes? Pardon? Your hemolytic condition was related to your transfusion? Yes. About the stress of COVID and if I affected, because I am in medical situation. So you don't know if you are affected or not by coronavirus?
No.
No.
If I understood you correctly, you have an increased hemolysis. Is this due to an antibody or what?
Yes, to antibody, as they say.
Are you an intermediate patient?
Major.
Major, okay.
Yeah, why do you think you had this reaction?
Antibody.
Yeah, but γιατί τόσο καιρό που μεταγγίζει το δεν έκαμε. So it was a sudden reaction due to the antibody? Yes, it is a stressful reaction, as they said. What was it? Repeat, please. Stressful reaction. Stressful reaction. I don't think that stress can bring that reaction to transfusion.
No, she's talking about an antibody. Doctor, this may mean that your blood banks do not have the facility, for example, to look for the rarer blood groups like KEL, for example.
Yes, there is a significant decrease in blood bottle number in the national bank. Okay. So the significant shortage of blood donors who are compatible with the difficult bloods is not there, and they create this. Okay, that is good. Okay, that the information is very useful. Thank you so much, and we are happy that you're well now. Yes. Thank you. Yes, I am well now. Thank you.
Hadibur, welcome to this webinar, and may I express my gratitude and thanks for your ongoing close collaboration in sending us useful material and in keeping in line with us. Thank you so much. Iran has not been so fortunate as the other two countries that have spoken on this, because I think that Hadibur will give us some useful information on the impact of the virus on thalassemia patients in our beautiful country of Iran. Hadibur, you have the floor.
Hello, everybody. Thank you, Andrella, for your good comments. In Iran, we are the first country after China which affected with the coronavirus. And the problem was, in the first day of the pandemic, the reaction of government was very slow, and this slow reaction put us into some problem. About 13 patients were involved in the problem and got COVID-19.
Okay.
And unfortunately, reportedly, 3 patients passed away because of the virus. 2 of them was intermediate thalassemia but transfusion dependent, and 1 of them was major thalassemia. One more report that I heard about the infected patient who passed away, but it was not true, because after investigation, I found out that he passed away because of a heart problem, not COVID-19. Blood shortage is a worldwide problem during a pandemic because of the reason other participants told in this session, but the COVID-19 taught us something important. We should change the strategy of blood donation. We should rely more on the live inventory, multiple donors. It is very important for the country. In Iran, we are relying in the multiple donors and call them to attend the center for donation. Because of this strategy and because of having a good contact with patients personally, we could manage the problem of blood shortage in short time. This is very important that the next strategy in shortage is patient blood management. We should have a good strategy about the canceling of elective blood use during pandemic. The whole hospital in Iran canceled elective blood surgery, elective surgery in the country, and because of that, the need for blood decreased in hospital, and it helps us to manage the shortage of blood. Blood donation centers should have a good network. In Iran, we have a network, and the network helps us to distribute blood through the country and compensate the shortage in different area. Because of that, we have got some sort of equality of the shortage in the country, but no difference between capital city and rural area because of the shortage of blood. Another thing is that we need more insisting on the comprehensive center. As you know, in the developing country, patients is going to general hospital for the treatment. In this situation, it is too hard for the patient to attend general hospital, which is replete with the COVID-19 infected patient. Because of that, we have got a matter of the attendance of patient for blood transfusion in some part of the country. And another thing is that delivering of drug is the same. They receive the drug in the hospital-based pharmacy or in the governmental pharmacy, which is important for distribution of COVID-19 drug. Because of that, some patients have the problem of the attendance. Afshan could say to you more about the job problem they have during the COVID, because in Iran, we don't have any facility for patients or non-patients about job day off during pandemic. Is there anything I should speak about that?
Job, yes. What do you mean job payoff? They are not. You have no social benefits in this pandemic to give certain remuneration to people that lose their jobs, or?
The matter is that although the government sent a regulation about the patient and the vulnerable patients, such as thalassemia, for workplace, but it was not mandatory for workplace to use that. And lots of patients must attend their job, and there were no day off for them. Because of that, they are involved in the COVID-19. As I said, 13 patients involved in the COVID-19 infection.
It happened in other countries as well. It was not mandatory, so the employers did according to what they felt like. Yes, we've heard that before. So the patients found themselves in a difficult situation.
Which patient?
So the patients found themselves in a difficult situation that they had to go to their jobs, not to lose them.
Yes. Some patients are working in hospitals.
Yes.
Some patients are like myself. Are working in pharmacy in the place is very close involved in the distribution of the material of COVID-19, and it was very difficult situation for some patients, especially adult patients.
Yes, I suppose this is the case in Egypt and in other countries about the job and the social benefits. Okay. And I would like to ask you, Hadibur, because you are a very good reporter, to write this in detail. We will not use your country or your name, but we will use the information because it's extremely valuable for us to report to WHO in a global appeal for the situation, so that we are always in the leading situation with hemoglobin patients. So I would like to ask you to report this in detail. And if Professor Bishlau is listening to me and can hear me, I would like to know the social measures and policies that have been taken in Egypt and in Iraq and in Lebanon, please, Michelle, with regards to how the patients found themselves socially address their needs. The social aspect is very important for our patients. Yeah, okay. Hadibur, anything else that you've got to report? I think you're okay.
Okay.
Thank you so much. I think the other country we would like to hear about is anybody else from Iraq? There is Afshan Shidlavan.
Afshan from Iran, yes.
Yes. Can you?
Hi. Yes.
Hello. Welcome.
Hi. Hello. Thank you so much. I'm happy to be involved in this webinar. It seems so useful. I want to add some points to Dr. Hadipour explanations regarding the work. Some patients have part-time jobs, workers, vendors, and after quarantine, they have lost their income. It's really a chaotic situation for them because of no income for managing the expenses. I have some claim that many patients have no money to buy the drug and medicines even. However, there are some independent charity movement to provide some to cover some of these expenses for them. One other point is that if from the shortage of the blood, many patients all over the country have activity in the form of the networking, published some similar posters and tried to advertise in different healthy groups, even in the social groups, official groups, or charity groups, and applaud them to take part in blood donation. Although it was chaotic at the beginning of the pandemic in Iran for the blood shortage, for the shortage of sanitizers, masks, and everything, little by little, it's down and seems to be under the control. For the general hospitals, as a treatment places of the Iranian thalassemia patients, some hospitals manage this situation by allocating far apart wards from the corona wards for thalassemia patients for blood transfusion. But I have my transfusion in the Zafar Adult Thalassemia Clinic, which is fortunately a unique center for blood transfusion. And really, we pray such having this priority in Tehran. This pandemic maybe remind the policymakers to think to have such unique blood transfusion centers for patients. For the drug shortage, medicine shortage, for about 2 months, we don't have Desferal in the market. There is a shortage, maybe because of the policy to buy or order from the agent. And also the pharmacies, we prepare the medicine, thalassemia medicine, is the same as the pharmacies, general pharmacies, governmental pharmacies that distribute the coronavirus. 2 times till now, I have waited for at least 1 hour between the people might be infectious. I'm not so sure if the people go to that pharmacy are healthy or not, but I had the obligation to get to buy my medicine at that special pharmacy. I reflected this problem to the Ministry of Health, some officers, but they weren't no good solution.
Sorry,
okay, thanks.
When you wait to the pharmacy, which is very rightly you said is not a very safe place to wait for long, but don't you wear a mask? Are you given a mask, a protective mask, when you're in such?
Yeah. When I have my obligation to stay at home, even no go to the work till the governmental obligation. However, whenever I went for blood transfusion and also preparing the medications, I have my own wearing masks, sanitizers, and gloves and something like that. Completely used the primary cautious.
Okay, so
Afshar and Mohammed Adipur, one question about Iran. You mentioned the difficulty of paying for your treatment. Now, if I remember rightly, only the imported drugs need to be paid for by the patient.
Yeah.
The drugs that are locally manufactured are free. Is this correct?
Yes. Yes, the generic drugs seems to be to somehow free.
Yes.
Okay. However, we pay for the Desferal, Novartis Desferal at the market in Iran. Then Dr. Hadipour, continue, please.
Was used by many patients, especially adult patients. In this manufacturing in Iran, they couldn't. In this situation, COVID-19, it is the matter of the agent of the Novartis company in the country, Shapaya, provide this for patients in the country. Novartis doesn't want to continue production of this fraud because of the fiscal
Mohammed Khalipur, can you write this, because there was a lot of interruption in your voice.
Interruption in your voice. We would like to have this detail, please.
Okay.
Okay.
Thank you very much.
You're welcome.
Yeah.
Do you have my voice?
We can't understand you.
It's noisy,
Okay.
Dr. Hadipour.
Yeah. Okay. Thank you very much.
Thank you.
You're welcome.
It was not Novartis.
Muhammad,
because they are willing to usage of the
Muhammad Isa. Sorry, Dr. Hadipour, because you had problem with microphone. I think we muted your microphone. Sorry. Thank you very much. Please mute your microphone. So we can go to the.
Yeah, you're welcome. You're welcome.
You have my voice?
Now
Yeah, we hear you, but there were so many interruptions.
Okay.
We would like you to write this in detail.
About the matter of Desferal in the country.
Okay.
Okay. It is not about related to the agent Shapayab in.
All right.
Muhammad Pukato again. South Africa.
By South Africa, I don't know.
Okay. You ask him.
Tunis.
Okay, Mohammed Nabil Isa from South Africa. Are you in?
Yes.
No. Hello,
Yes,
how are
can
you?
hear me?
Yeah, we
Yes,
hear
I
you.
am. Can you hear me?
Yeah, we
Yes,
hear
you.
Okay.
Mr. Issa.
Yes.
Mr. Issa, how many patients
Yes.
thalassemia in South Africa? We never managed to get a number.
We are not a lot. In the biggest center in Johannesburg, there's about 100 patients.
Okay.
So it's
يلا حاجة تعال.
It's very small compared to all the other countries that were on talk now.
And how has the COVID-19 infection affected you?
Mohammed, do you hear us?
We've lost you.
Anyway, we can move if you want.
Yes.
Okay.
Yeah.
Can you ask him a question?
How did COVID-19 affect the thalassemia patients in your center, in your country? No. So let's go now to Algeria, and then
She's
to
not,
KSA.
she's not in.
Algeria is not in. What about KSA? Okay. All right. So
We can go to George.
Canada is not. Only George is there. Manal has spoken.
Yes.
Manal,
No. She can.
Yeah. Okay.
Manal, are you in? Manal Zata. Hello.
Yes. Can you hear me?
Yeah, we do.
Yes.
Yes. Sorry for being late. I had a very bad connection. We have in Egypt today a very strong sandstorm.
Yeah.
So I missed some of the talks.
They have a storm, a sandstorm.
Really?
Yes, a very strong one. Very
Okay. It's going to come over to Cyprus as well. Today or tomorrow.
It's coming. Yeah.
So Professor Bashlawi has said very good things about the COVID in respect to the fact that there is no thalassemia patient infected.
Yes.
Do you face any challenges that you would like to share with us?
Yes, I would like to speak generally speaking about the situation, and I have I observed really a very good two positive aspects that I will talk about at the end. But first, I really would like to thank TIF for all the hard work, commitment, the valuable contribution. You cannot imagine how the brochures you're releasing are really very informative. They're giving reassurance to the patient, especially at the time when there was rumors about getting blood will infect people with COVID-19. The brochures really helped a lot. And I can tell that you're demonstrating the phrase that you always say in all the conferences, like knowledge is power. It is really demonstrated in a very practical and tremendous way. So really, I'm really appreciating your efforts. Thank you so much. Definitely, Dr. Bashlawi has said that we don't have any patients, but we have shortage of blood, of course. And I think it will be a little bit worse, especially in Ramadan, because people are fasting in the morning and we have lockdown at the evening. So I think it would be really helped a great deal in this. We had a very big campaign on the social media urging people to donate. And I think we it had some good impact. The association also have advised blood banks like to put. People are afraid to donate because they don't really want to go to hospitals and centers and to get in any medical areas where they can get infected. So the association has advised like to put some donation cards in like in big streets or and sometimes they put in residential compounds where they encourage people to donate like in open air, and they actually we have succeeded in this. What was really very important to the patients was that because of the shortage of blood in their centers, sometimes they have to like reschedule in other centers that where they can find the blood. Usually here we have some legalities if a patient goes from his center to other center. So there is a lot of paperwork. Sometimes you pay fees. Also, the association has succeeded in this. They made like some efforts or talks to some governmental people that are to exempt patients from paying any extra fees. They just go to this center and have their blood. In Cairo, we don't have a problem in blood. In some other areas or some other cities there is shortage, especially in Alexandria. But there is strategy. It's like every center is adapting to the need. Sometimes either the reappointment, either they go to other center, or either they they can, if a patient is like taking two blood, they're managing, but it differs from one center to the other. But it's also shortage of. Hello.
We hear you. Okay.
Hello.
Oh, hello. Can you hear me?
Yes, Mana, loud and clear. You may continue. Thank you.
Yes. As Dr. Androla, answering your question about the social assistance, I can tell that many of the patients here either work from home, and we have like a certain category of patients who either who depend on sometimes working to have like a daily. They don't have a constant salary. We have here a program. The government has implemented a program where these patients or any other person or any other, he doesn't have to be a patient or a thalassemic. In this pandemic, they offered a program where you go to the Ministry of Social Insurance and you like report your WhatsApp on a certain number because they don't want people like to go and have like a crowd or something like that. There is a certain number that you report your case, report whatever the situation on a WhatsApp account, and they communicate with you through the WhatsApp. And they in this program they are giving like a sum of money, a small sum of money as a kind of help. It's not a really big amount of money, but it helps. From which bank you take this amount of money, and this program is implemented for 3 months. It started this month, and you have and in addition to other 2 months. The positive thing that I'm observing that is, in spite of this huge stress of the COVID has put on the patient, I have observed several positive aspects. Actually, patients after COVID are really complying to their treatment and chelation. They believe that this will keep them healthy, raise their immunity, and not only this, but they are adding tons and tons of supplements and antioxidants. and really following a very healthy lifestyle. They're really afraid, and they believe that this is their only way to be saved from the COVID. So that's the really positive thing. I know some people, patients that who aren't really, I cannot say that they are strictly committed to their chelation. Now, after the COVID, they believe that this is their way out from this pandemic. The other point that I really appreciate, and I didn't really feel, except after the COVID, that this crisis here really demonstrated the importance of the relationship between doctors and patients in chronic diseases. I must take this opportunity to thank Professor Bouchlaoui and other Egyptian hematologists for keeping really an effective communication with the patients in this tough time. They are really a sort of support, reassurance, security. They're not in these days. Really, they're not a hematologist. They're psychiatrists, nutritionists. We're calling them every time. I'm calling my doctor after midnight, actually asking questions. They're really giving us support. So really, in chronic disease, this relation is really so important. I can say that. Excuse me?
Yeah, thank you so much, because this is very impressive. Thank you so much.
You're welcome. Thank you.
These are important insights.
They are very important insights coming from patients and doctors, and we are really very, very thankful to you. Mm-hmm. Can we have Algeria on the line to hear our friend Halima Rahmani?
Hello.
Hello, Halima.
Hello, everyone.
Thank you very much, first of all, for all your support you give to TIF. All
Yes.
your translations, all your interest. Hope you keep safe. Tell us how things are in Algeria, please.
Yes, thanks God. We have not reported any cases of thalassemia or sickle cell disease affected with COVID-19. And since the beginning, we were very scared for the situation, and we have many problems in the beginning. But our center had took many instructions, so they have limited the call check. All the call check are postponed. Only the patient who come to the hospital for transfusion or exchange transfusion or acute complication, and the other check by phone. They call the doctor by phone and asking them if any complication in the day. The mask and the clothes is mandatory for all healthcare professionals, and also for the patient who come for transfusion and other complication, and respect the distance when they are in the daycare unit.
Blood shortages, Halima, do you get transfused as regularly? No blood shortages?
In the beginning of for the period of pandemic, we had a lack transfusion, but actually the blood center and many associations has now stopped raising awareness among the population for blood donation, and by blood campaign organized by the Blood Transfusion Center with the contribution of many associations like the Islamic Schools and other national social associations, and the Transfusion Center has implemented a rigorous selection protocol and updated the questionnaire of blood donation. Also ensure the safe environment for the reception of the donor, with several preventive precautions to encourage the donor to come. We call them by phone. We ask them some question to avoid coming to the center for other thing. And the center has increased the mobile blood collection unit to go where the donor can donate blood in their neighborhood.
Okay, thank you very much. So you don't reckon that there is a problem at the moment in regular blood donation?
Yeah, in the beginning we had a problem, but now everything is okay.
And now reported cases. That's very good. Thank you so much for your contribution and your support. Thank you very, very much, Rima.
Thank you for you. Happy to know that you are all well.
Thank you, my dear, and we're happy. So I think that we have completed the circle, but I think that I will give the last word to George and Anton, who are Anton is not in, to George, who lives in a European country, in a country like UK, which have a very robust infrastructure in national health service, in national blood transfusion services. George, let us know, because there are infections in the UK, there are infections of thalassemia patients in Europe. Very impressively, we found out that there are no infections in the Middle East and this part of the world except Iran. So, George, tell us of the benefits that your system has given to you in terms of home transfusion, in terms of security, but also the fact that despite all this, you have infection into the hemoglobinopathy group. Let us your experience, please.
Hello, everybody. Can you hear me? Hello? Hello?
We do hear you, yeah.
We can hear you very well, George.
Okay.
Okay. So basically, well, firstly, I am exceedingly impressed that the coronavirus is not affecting as many people as one thought it would do. From what I had, some very few which were affected, and unfortunately, very few of them had fatality. But it looks like all the precautions that people very quickly set up are maybe that's what's happening. It's that we are protecting all the patients because of all this sort of organizational changes that was made. In England, yes, there are patients who have been affected. Some of them, I have not heard of anybody dying, but I've heard of some patients getting infected and then going through it. Also, I've heard of the same thing happening in Italy. I think in Italy, there were a couple of patients who unfortunately have died. The way that the hospital where I was dealt with this is that they immediately increased the hours that the unit would be open, and then they split those days into 3 specific sessions of transfusions and reduce the amount of people that would be there. So there is, for example, every day between 9 and 12, which gives you three and a half hours. Then between 12:30 and 4 is the second session, and then the third session is between 4 till 7:30 when the unit now closes. That's helped to reduce the amount of people that would be in the center at any time. The other thing that happened is that they actually found in my hospital, this is not the case in every hospital, they have found a unit that you did not have to go through the main hospital to get to the unit. It's an outside building, which means that any patient will not have to go through the hospital and waiting queues or getting big lifts with other patients. And the other thing that has happened is that a selection of about 25 people that get transfused, but were considered to be very vulnerable. For example, I am one of them, or thalassemia patients who are pregnant, or any other real problem patients which are very vulnerable. They transfuse them at home. That's a fantastic move, and it helps a lot because somebody who is vulnerable, any possibility of in the hospital would have created a big problem. Unfortunately, this I don't think is happening in many other hospitals, but I think they are trying to. That's as far as my question is it because everybody has been doing so that patients don't we haven't had many patients with the coronavirus, or is there another explanation? Hello? Hello?
Yeah, are you hearing us? I think that your question needs a lot of debate, answered or addressed or discussed. We are not sure, maybe both factors are possible, that everybody was so obedient, adherent, compliant to the measures that the governments were advising people to make. Maybe thalassemia patients got even more scared than people without thalassemia and took even better precautions than the non-thalassemia patients. Maybe blood transfusion and oxygenating cells provides protection. Maybe some other factor. We are not really dipping into the science of why patients are, or maybe underreporting. Countries may be underreporting in rural areas, in areas outside the cities, because most probably the problems, the huge problems or the most severe problems are those outside and reference centers and transfusion centers in the rural, in the distant areas. So there may be underreporting of that. Usually it so happens that the cases are well documented in areas where there's good reporting. There is good national registries, very comprehensive reporting, doctors that are going through publishing their results. So all these factors may contribute to the fact that patients in most countries of the world have not reported cases. The only country has been Iran, apart from Europe. So we will have a panel discussion and an interaction to see which factors are contributing to patients not being affected, and those that have been affected in Europe. The greatest majority have been discharged from hospital without any fatality, as George mentioned. But then in Europe, they are well transfused. They don't have to travel long distances. There are many reference centers. So we really need to keep very well isolated, keep isolation, keep protection, keep continuity of care, because that's very important. And the perception of many patients I have heard on this webinar, but also on others, is that they felt that taking their medicine, taking their chelation, being transfused, makes them resistant to the virus. And that's a very good thought, because it's also true. Keeping to the to the standards of care, to the basic care, is what may keep the virus possibly away, keeping the patients in good health.
Before we close, are there any questions from any one of the participants?
Hello? Any questions?
Yes, I have. I just have a question regarding the blood donations. Do we have to do any research regarding the blood that we receive, if it has IgM inside? Is there any ideas that you want us to explore or to look into during this period of time?
Blood transmissibility or past infection that is protecting the patient from receiving the blood. At the moment, there is no evidence of a good antibody testing that would reveal that the donor has passed the infection and is not and is immune and will not be infected again. At the moment, nobody recommends antibody testing. And even if the government sets to test for people for their antibodies, it will not be reliable at the moment information, because the value of the presence of the antibodies is being under evaluation, the value. So nobody of the regulatory bodies, and we don't recommend yet antibody testing of the blood donors, but it is important to keep post-donation questionnaires and post-donation follow-up of the donors to see who develops symptoms and then trace the donors and the recipients. The Koreans in Korea have put a very important program of receiving the information from their government of the COVID-infected people, so that they can recall components or prevent transmission, donation of the components. But I don't think at the moment there is any investigation that we can advise people to do.
Okay, if there is no one.
I want to have a comment.
Okay.
Yeah.
Yeah, Mohammed.
Can you hear my voice? Okay. The matter is that I attended an ISBT webinar as well about the blood safety and blood provision during COVID-19. And it is the most important suggestion from ISBT and AABB side to make sure donor about the safety of blood donation place. It is very important. NGOs should work on these things to make sure donors about the safety of the blood donation place.
Yes, yes. I think you are very right, and this is what we have been advising since the beginning, that not to lose their confidence. Blood donors should not lose their confidence in the place where they give the blood, but also everyone should make sure that indeed the blood donation places are safe. Not only to tell people that they're safe, but to actually make every effort. And I think this has been made possible in most countries and in most centers.
The question is to convince the donors.
Yeah, to convince the donors. That
So spreading information and reassurance has to be intensified.
But on the other hand, donors are people. They are members of our community. Some of them are in quarantine. Some of them have been infected. Some of them are not allowed to travel. Public transport is not advisable. So donors are members of the community. There is only some things we can do to bring them. You know.
And Andrula, on this point of blood donors, in England, there was a period that they were actually not advertising, but they were announcing in different news and whatever, that because blood donation increased, and they were saying that, look, if you come for blood donation, it doesn't necessarily mean that you're going to be tested for the COVID-19.
Yeah,
People,
in fact, they are not tested.
People misunderstood that if they go for a blood donation, they will be tested.
Yeah, yeah.
Well, let me ask a question. Why not actually offer it? This would be, this is the best way to actually make these blood donors feel comfortable, that, and also get something out of it, and that will hopefully bring them back. I don't know. It's just a thought.
George, first of all, there is no reliable antibody testing that would give them a responsible and well-evaluated, assessed answer, even whatever the result may be. Secondly, if you do
is the same test that they're doing now, testing people.
No, the RNA, no.
No. I know, but if you're offering the simple test, at least you're offering people.
Some kind of service.
Actually, George, we are thinking of offering the IgM for donors once we receive the kit in Lebanon, because on the Architect Abbott, on the Architect machine on which you can do the serology, you can run this test, but this is still not available at the moment. It might be available very soon. So once we have the information, we will share it with you.
There is an FDA-approved IgG. It's an FDA-approved IgG testing. But in every laboratory, when you find an IgM positive, you need to go ahead to do a further testing to confirm that there is an active infection. And on the other hand, if you find IgG positive, you also need to have another reliable FDA-approved test to confirm your positivity. So it's not a very easy, in a laboratory, there is an algorithm what a positive test means, what an intermediate test means, and what an IgM positive means. The reluctance of people to put it is because there is no clear assessment of what it means. I think Germany has done considerable work on this, and we are following it because I'm sure they come out with an assessment, and England is doing it. UK, for example, some of my people there, the doctors, have told me that in surgery and everything, they are examining them and they are collecting information of what this test means. As soon as we have more reliable information, of course, the governments will assess and put it forward, because it is a good solution. You bring people back. If there is a confirmation that you passed the infection, it means you will not pass it again. You can go back to work, because some of the impact that this virus had was people to go out of the jobs, people not to work, the economy to go down, donors not approaching. So if there is a good evaluation that when the presence of antibodies are confirmed by another test as well and is positive, and it means that it's neutralizing antibodies, then you can go back to work as well.
On a practical level, of course, there is a lack of material at the moment, and these are thoughts that can be put into practice in a couple of months, hopefully.
Yeah, I think RNA is the only test we can do now for active infection.
Yeah.
And wait for the assessment of the countries and the governments that have done this in the right way, with the right algorithms, to have a good assessment. Otherwise, it will confuse even more the people what they mean to have IgG or what they mean to have IgM, particularly blood donors. Also, if you think that if you have an IgG and you have passed the infection and you are not going to take it again, it will make you even more relaxed not to keep those preventative measures very well, and that's very risky. So, all in all, this pandemic has taught us many things, as all of you have said, and I think Hadipur touched on a very important issue that governments and national transfusion establishments should consider strengthening their patient management programs. Very important. Their hemovigilance programs, blood donations, clinical use of blood, and other programs that have been recommended so many years ago, but people have not took so serious consideration of them. Let's hope that thalassemia patients and all people keep out of the virus. Please keep in touch with us. Inform us as soon as you have any news so that we can compile important and reliable information and help you with your governments. A last word from Michael?
No,
Excuse me, I have a question, please.
Okay. Yes.
Yes, go ahead.
Is it true that there are 3 different strains from the COVID-19, and this explains why there is a diversity and variation of severity from one country to another country? And if you have an antibody for one strain, it doesn't mean that you're protected from the other 2 strains. Is this confirmed that there are 3 strains from the COVID?
No, we are not aware actually. It hasn't been said or published that there are 3 strains. It's just that the antibodies that this virus, in particular the COVID-19, the SARS-CoV-2 is producing, is not certain whether they are of the protective nature or what level of these antibodies should be in blood to actually provide protection. So that's where we are at the moment. Yeah.
Yeah.
Okay, thank you.
And we'll keep in touch with science and you. Thank you so much. Have a nice weekend. A safe and pleasant weekend.
Anyway, thank you, everybody. It was wonderful speaking to you.
Thank you. Stay safe.
Thank you so much.
Thank you.
Bye.